السلام عليكم. أنا دكتور جواد الديوان. محاضرتنا اليوم on scientific writing، الكتابة العلمية. عندما نقصد الكتابة العلمية it is the writing of articles, theses, report, proposals and so on. Article, which is a piece of research, will be or published in journals or in conferences. Thesis, it is on diploma thesis, MSc thesis, PhD or report thesis, and reports and proposals. Proposals, that's what we introduce to the scientific committee to get a permission of carrying on out a research. All of these, although it is different in names, in purposes, and in shape, in frames, they are all under the frame of scientific writing. Generic principle for the scientific writing, that is to say, the same structure, the same guidelines will be applied for research proposal, ethic application report, journal paper, and poster presentation. In conferences, nowadays there is a poster presentation, so you can present your article, your piece of research in a poster in the conference. The beginning of the article, the beginning of the thesis, the beginning of proposal, the report, and so on is in title. And there are different type of titles. Just to know there are different type of titles: indicative title, informative title, question type of title, and main subtitle اللي هو series subtype, which is difficult to persuade the journal in it, but it is present. They are main subtitles. Examples of the title: these are examples of titles from Iraqi research, which is published. For example, hirsutism in patient with polycystic ovary syndrome in post-conflict Iraq. The title refer or indicate that it will be on hirsutism and mainly or hirsutism just in polycystic ovary syndrome. But when in the post-conflict Iraq, that's to say Iraq after wars and after conflicts, it is just as if it suggests there is something in post-conflict Iraq with this phenomenon. The second type, neonatal mortality in post-conflict Iraq. Also the suggestion that the conflict causes something to the neonatal mortality. Polycystic ovary syndrome in post-conflict Iraq, it is different than the first one. The first one dealing with hirsutism, and this dealing with the syndrome, and also in post-conflict Iraq. إذا هذه الأمثلة نخليها براسنا ونروح إلى التايب أوف تايتل اللي خليناها indicative questions إلى آخره، راح نلقى بعضها ما يترافق وياها. Is it merely it is must these types? No. This slide or this talk is just to pay attention for choosing, to careful choosing and careful writing the title of the research. Classical teaching refers to SMART. SMART, which is the beginning letter of the word SMART. S for specific, measurable, attainable, relevant, time-based. It is just to organize our thoughts to be in such a manner, smart. Now, can we apply smart to the titles, or yes, to the example of the title in the first in the previous slide? Yes, we can. There is specificity, the specific words. The problem is measurable. When talking about neonatal mortality, it is measurable. When I'm talking about parasitism, it is measurable. When we are talking about others, it is measurables. Attainable, can we attain the data or the situation? Yes. Is it relevant to our work? Yes. And time-based, which can be finished with that period. And time-based, we are referring to them in post-conflict in Iraq. Now, the title page, the first page will be the title page. Nowadays, students of board or something like that, they are putting the title, then introduction or title, then abstract. The title will be in the first page, the title, then the authors in the order, then the source of support, who's supporting this work. So the first page is important. The authors establishes responsibilities in paper writing, and these are avoiding to hurt feelings of the others. We have to be careful in writing such things. All the articles or theses contain IMRAD, that's introduction, methods, result, and discussion. So introduction, why did I do this study? ليش سويتها؟ And this is very difficult to be answered. We must refer to something that motivates us to hold such a research, such work, or to publish such work. That's mean, why did we do this study? In methods, what did I do? ماذا فعلت? ماذا فعلت? That's mean design of the study. فعلت. ماذا فعلت? Sampling. How was the sampling? ماذا فعلت? Size of the sample size. And there are questions and so on. ماذا فعلت? Collection of data. ماذا فعلت? Collection of data, and collection of data could be in the laboratory, could be in records, could be in interview. So there are several ways to collect data, and the data may be in the records of hospital, records of health center, records of Ministry of Health, records of Ministry of Planning. So we have to refer to that. Then statistical analysis. شلون سوينا هذه الجداول وهذه الرسومات، هذه الفيجرز، وكيف وصلنا لهذه الأمور. Then the result, what did I find? I found rates, I found prevalence, I found causes, or I found associations. Any other finding could you think about? If you are dealing with diabetic patient of type 1, for example, and you want to know how much they were controlled, this diabetes. So we are talking about glycemic control. So it is a rate. We have to find the rate. And the glycemic control, before we are talking about the rate and the method, we have to define it. There is operational definition. What the meaning of glycemic control? What's the meaning of hyperglycemia? What's the meaning of hypoglycemia, for example? Or if we are dealing with something, dealing with war, with fear, with stress, or with depression, or with weight, or with height. So if we want to study the effective of the clinic in dealing with type 1 diabetes, which is in among children, we have to examine the growth. And the growth, weight, height, BMI, and so on. There are several indicators. Weight for age, height for age, weight for height, and so on. These will be explained in methods and the cutoff and how much was abnormal and how much was normal. And so we can arrange these things. Again, IMRAD means introduction. Why we did that study? We have to explain. That's the hint. Method. What did I do? How I reach to such result. So, first of all, the design of the study. Let's mean cross-sectional, case control, cohort, and so on. After that, the sampling. The sampling, is it random? It's convenient. And how much? The sample size. Then the statistical analysis, and so on, and so on. Result means what did I find? وأعطيت أمثلة عليها. The discussion, so what? Then I found low rate of glycemic control. Then what is that? That's mean no effort was done to control that diabetes. There is something wrong here. The patient, the parents, the health system, and so on. We have to discuss this idea. هذا يفرق عن جماعتنا مثلا يجي يكتب discussion ويقول والله أنا النتائج مالتي تشبه نتائج فلان وتشبه نتائج فلان وتختلف عن نتائج فلان. It is not like that. If it is different than نتائج فلان, than the finding of others, we have to explain. Different than the findings in other countries, we have to explain. This is discussion. This is discussion. So in introduction, why do this study? ليش صارت؟ هذا نعبر عنها بأشياء كثيرة. الباك جراوند، rationale, aim, research question. Background, what do we already know? No, what do we already know? What is known about the problem? If we are talking about glycemic control, as I mentioned in the previous slide, then how much the glycemic control in our country and the other countries, in the neighboring countries, in the developed countries, in less developed countries, in underdeveloped countries, and so on. We have to declare that. This is what we already know. If we are talking about infectious disease, how much the prevalence of the infectious disease? And what is about the spread among children, among adults, among females, among males, among school children, and so on. So we have to find something which is background. Rationale Why does it matter? لماذا هذا الموضوع يهمنا؟ يهمنا يتعلق بصحة الناس، يهمنا يتعلق بالنظام الصحي، يهمنا يتعلق بأنه expenditure، يهمنا لأنه يعني failure، يهمنا لأنه يعني neglect، يهمنا يعني أنه يعيق البروجرس مالنا. وطبعا يفرق الراشنال من مكان إلى مكان. What gap in our knowledge does this fill? What gap in our knowledge does this fill? إذا نتحدث عن glycemic control among diabetic children، معناته الأم مالتي I want all the patient, most of the diabetic patient will be controlled, glycemic controlled. If I am talking about defect in school achievement among school children, diabetic school children, the aim of my study is to get the best school achievement among diabetic children. And there is research question. The research question to be answered. إذا نستمر موضوع الجلايسيميك كنترول كمثال among diabetic children. Research questions: is it possible to control most of diabetic children? Is it possible to get glycemic control of most diabetic children? إذا نتحدث عن corona, novel corona, is it possible to control novel corona? Recent infection? That means we are talking about effectiveness of control measures, wearing mask, social distancing, and reducing crowds or نتجنب الكراودز. Is it effective? So there is a research questions. أعتقد هاي الأمثلة ممكن أن تعطينا نبذة عن هذا الموضوع. إذا رحت للmethods study design تحدثت عنها. What sort of study am I doing? Most of the disease بالpostgraduate studies هي cross-sectional study because it is the easiest one, or case control. Second, the case control. The population who are in the study, who are excluded, who are in the study, who are excluded. So there are inclusion criteria and exclusion criteria. هاي المشكلة اللي دائما يقع بها الطلاب. عندما يذكر inclusion criteria راح يذكر عكس exclusion criteria، بينما هو الحقيقة عندما ذكر inclusion criteria يعني اللي يدخلون بالدراسة، عكسها ما راح يدخلون بالدراسة. فاكسكلوجن كرايتيريا لازم يخليها للناس اللي ماشي معهم هذا الموضوع. setting وين سويناها؟ where and when does this study؟ مستشفى، مركز صحي، بالصيف، بالشتاء، بالأشهر، بالزمن. والmeasurement what do I measure؟ I measured height، I measured weight، I measured HbA1c، I measured uric acid، I measured lipid profile, and so on. So measurement analysis, how do I make sense of these data اللي تحدثنا عنها. Result, what did I find? فإذا we have to describe the sample. The sample we have to describe the sample. Who were they? The number, sex distribution, age distribution, educational distribution, residence distribution, and abnormality distribution, and so on. So we have to describe our sample. Response rate. We want to study the stigma among medical school in the College of Medicine. stigma about mental disease because they are student of medicine, student in medical college, supposed to be without stigma on mental disease because mental diseases look like any disease of the body. So there is a response rate. If I distribute a questionnaire on a number of people and the return will be another number, so there is a response rate. Output. What are the result of my analysis? This is the output. On a stigma, for example, on mental disease in a College of Medicine, the response rate was 90% or 80%, 70%, and so on. And I found that 50% of the students were expressing stigma. This is failure of the system. And that number of male, that number of female, that number from the first year, and that number of 6th year, and so on. This is the output. Result and finding. Result and finding, some refer to result as quantitative and the finding as qualitative. لا بأس بهذا الأمر. We can follow it. But these results and finding are in text or in table and figure, provided that no duplicate. يعني ما يصير أذكر حقائق in the table وبعدين أراويها in figure. ما لها معنى. مو شرط الريزلت أن تكون لها positive حتى تفيد. وإنما it is the negative result is an important to report also. يعني ما يصير أنا أختار بس البوزيتيف وانشر، حتى النيجاتيف لازم تنشر ومهمة مثل ما مهم البوزيتيف. discussion اللي احنا حكينا عنه قلنا so what. How does what I found fit into what I already know. أنا بالباك جراوند كتبت ما أعرفه وطلعت عندي نتائج، فالبرنسبل فايندينجز تتوافق مع ما أعرفه لو تختلف مع ما أعرفه. تختلف we have to explain. ربما الزمن، لأن أنا اللي أعرف شيء صار له فترة وهسه صار فترة آخر، ربما الزمن غيره. الزمن غيره، لازم أحداث صارت خلال هذا الزمن غيرته. changes تغير به. العمر اللي ينطق به طفل مثلا بالسبعينات بالثمانينات بالتسعينات، نقول العراقي، الطفل العراقي ينطق في هذا، يقول كلمات في هذا العمر ويكون جمل في هذا العمر ويكون مقاطع في هذا العمر، أو يدرك بعض الأمور في هذا العمر ويجيب على الأسئلة في هذا العمر. عندما أجي الآن وأشوف وأدرس هذا الموضوع وألقى العمر هو متأخر بالنسبة للسابق، إذن هو يختلف عن ما عرفته بالباك جراوند، وأقول it is a matter of time، بس I have to refer what was changed in this time اللي هي electronic instruments، smartphone، computer، pads، tablets، TV, and working of women. So loss of contact between mother and child, between father and child, between family and child, lead to the delay. So I found that. I refer to the finding, then it is different than the principal finding, and this might be. I suggest some of causes which I noticed. ربما غلط. لكنها لوجيك. إذا انعاد هذا البحث من قبل آخرين ربما يطلع صحيح. This is how can we discuss things. Strength and weakness. What are the strength and limitation of my study? كثير من الدراسات ما تذكر limitation. It is difficult to comment on limitation. For example, كان هناك survey on the mental health of adolescents بالعراق ب 2006 and 2006 was a hot year. It is the peak of civil war. So there are hot areas which cannot be reached by the survey team. So we missed some of our sample, which affect mainly our result. So we have to explain. This is limitation. Limitation is conflict. Implications. ماذا تفيد هاي النتائج in practice بالسياسة for further study. In practice عندما أتحدث in practice for example عن glycemic control التعليمات أو the tradition بالعراق أنه لازم يعالج في عيادة سكر في مستشفى بها sub specialty of endocrine، ووجدت أنه the rate of glycemic control is low أو بها مشاكل والصعوبات اللي يجي إلها we are missing the patient because of transport, because of conflict, because of economic status. So it can be done in health center. So this is in practice. For the policy, I can change the policy to أن أعطي صلاحيات للمركز الصحي أو للطب الأسرة، لاختصاص طب الأسرة، لاختصاص الرعاية الصحية الأولية، إنه تعمل على هذا المفاد. This is a change in the policy. For further research إنه راح نشوف بالمراكز الصحية they can do this job or not. And the conclusion. ما هو الاستنتاج؟ الاستنتاج ماذا توصلت إليه من معلومات، ولا بد أن يكون short، يكون specific، يكون accurate حتى ينكتب. A sample of the component. الحديث اللي تحدثت عنه لازم كل شيء موجود available وأقدر أوصل له accessible. grant proposals لازم موجودة. ethics application reports. ethic application أنه لابد وأنك مؤسسة تعطيني الموافقة وترى أنه هذا البحث يتوافق مع الأخلاقيات العامة للبحوث. لازم أكو داتا سيت موجودة. أيام زمان ماكو. الآن عندنا قسم من هذا الداتا سيت. إذا ندخل إلى وزارة الصحة راح نلقى داتا سيت. إذا نذكر إلى جوجل راح نلقى البحوث العراقية المنشورة اللي مجلاتنا بدأت تنزل الداتا على الإنترنت. So we are in progress. وكيف نستخدم البيبلوغرافي اللي هو use software and notes or reference work and so on. So there are a progress and be consistent in your writing اللي هو لابد وأنه نهتم بالspelling. احنا من نناقش احيانا طريح نقول هذه اخطاء املائيه لازم ننتبه لها، يقولون احنا ما تناقش العلم تناقش. No, spelling is as important because the language is important too. حتى يوصل العلم. To explain the ideas. To ease the perception of the problem. Tenses الزمن. عندما أتحدث عن future شكل بالبروبوزل ونتحدث عن past عندما أتحدث عن الريزلت مالتي and so on. عندما أتحدث عن الشخص I or we or third person the researcher or so on. عندما أتحدث عن singular or plural and so on. There are many. تكتسبها بالتجربة، تكتسب التجربة وتكتسبها عندما يعيد النظر لك شخص آخر هذا الموضوع حتى تتعلم من عنده. أما هكذا ما نقدر نتعلم. ولهذا بالعالم الآن أكو واحد يسموه ميديكال رايتر، قد يكون طبيب وقد يكون غير طبيب، لكنه ملم عنده معلومات طبية ويقدر يراجع، ينطوا الارتيكل ويراجعها حتى تصير بشكل مضبوط. keep to the structure، لازم اكو logic flow from one part to other، لازم اكو منطق عندما نسترسل وننطلق من مكان، ما يصير نتحدث عن موضوع ونتركه فترة على غير موضوع ونرجع على الموضوع. to make the text in the correct place. ولذلك لا introduction بالميثود و no discussion result، فيكون logical and easy to read. sentence one idea per sentence، ما يصير الجملة طويلة عندنا، نوبات يجي لك الجملة ما التفت 4 أسطر 5، ما يصير. one idea per sentence، ويقال انه 13 كلمة بالجملة هي فشي زين مهم. several short simple sentences are usually much clearer than one long sentence with subclasses. مهم هذا التعبير، مهم أن يكون one idea per sentence. فالconstruct subject verb object حيكون أسهل لما تكون هكذا. وإذا طلعنا من الجملة راح ندخل بالباراجراف. These help to order the thoughts، هي اللي تنظم لنا الأفكار. باراجراف اللي هو one topic per paragraph، one thought per paragraph. الفيرست سنتنس بالباراجراف مهمة لأنه introduces the topic، وهذا الانتقال relate to one idea to the next، من فكرة إلى فكرة وهكذا، ولازم نسويها short 2 to 6 sentences. فإذا مهمة نعرف شنو sentence، مهمة شنو نعرف paragraph،